Today we will talk about CBCT. Now, CBCT is known as cone beam computed tomography. It started in 1982. That's the first CBCT scan that was done. It's an isotropic CT scan and it follows the principles of ALARA, as low as reasonably applicable. So the lowest dose that we can apply, that we can get a CT or a radiograph with. Now, why would we go for a CBCT? First, for impacted teeth, to see if they're buccal, lingual impacted, to see if they're close to the ID canal, to see if they're close to vital structures. For cleft lip and palate, to see the bony defect, and to assess if we need to take anterior iliac spine grafts or we need to take ramus grafts if it's small. So to see the defect that we have. To assess skeletal discrepancies, as in planning for oral surgical procedures like orthognathic surgeries and so on. To assess root resorption, how much resorption is happening in the roots. Also for TMJ, to assess the TMJ itself if there is any bony problems with the temporomandibular joint. Surgical and implant planning for tumors resection, for implants, to make models from it. All of those can be done, to make surgical guides with it. For endo, to assess missed canals like the MB2 and the upper 6. For perio, to assess the bony defect, the bone resorption that's happening around the roots. And in forensic dentistry, it has some implications as well. Now, a small revision. We have coronal plane, the sagittal plane, and the axial plane. So the CBCT will have all these three planes. The axial, we cut it into upper and lower parts. The sagittal, we cut it into right and left. The coronal, anterior, posterior. So here we have a 3D reconstruction. Here we have sagittal scan. Here axial scan. And here coronal scan. Now let's remember the face. So here when we cut the face into anterior and posterior, it would be coronal. When we cut it into right and left, sagittal. When we cut it into upper lower, axial. Now sometimes we can have some artifacts with the CBCT. These can be patient related or scanner related. The patient related, like metallic restorations, crowns, all of that. For the scanner, the poor calibration or imperfections in the scanner itself. So here, for example, we have a cupping defect, like a cup, a scatter, we can't see if there is anything in here, and the beam hardening. These are all problems that we can see, or artifacts that we can see with CBCT. So now we'll talk about small anatomic structures that we need to know. Here we have the pterygoid plates, the maxillary sinus and the septa in it, the bone, the palate, the nasopalatine foramen, here the airway space, here the impacted tooth, the teeth, and here the ramus, here the ID canal as we can see, and this could be a lesion after an extraction or an unhealed socket if it was a new extraction. And here we can see the mental foramen. So here we have a tooth, an impacted tooth close to the ID canal. See? Here's the wisdom tooth. This is the ID canal. Here, we follow it, and this is, it could be inside and it could be just touching the canal. So here we need to be very careful when we do extraction for this. We can do coronectomy for it, and we could do extraction as well. Here, for example, this is a case for implants. We assess the buccolingual width and the mesodistal width. Now, here we have 30 millimeters towards the ID canal. Now, here we need to be 2 millimeters above it, so we can place an implant about 10-11 millimeters safely. And buccolingually, we have good amount of bone that we can place an implant in. Now, this is the system or the application that all of us use for CBCT scanning visualization. It's called CareStream. It comes with any CBCT that you take. It comes with it. So you can download it and it appears. Here we have an implant case, bony defect. Now, let's start to follow anatomy. So here, we start slowly. We can see the pterygoid plates, we can see the maxillary sinus, we can see the malar projection. We start to see the ramus, we start to see the teeth, the nasopalatine, the greater palatine foramen. Here we see the wisdom teeth. And here we see the bony defect after the extraction. This is for implants. Now, we need to be like here. So, as we can see, that's how we can define if we have good bone healing in the area or not for implant placement. And here we see the hyoid bone. Now, for soft tissue, we would need an MRI or a CT scan with contrast. But if there are stones, we can see it on this CBCT. So here, for example, the submandibular gland. We can see there are no stones in it. Now, this was the axial cut. Here we will see which cut. Coronal, because we cut it into anterior and posterior. It's for the same case. Here the ramus, the ID canal, we can follow it from here. Now, for example, here I cannot plan for implants if I want to plan for an implant. I would need the axial and the sagittal cuts to plan for an implant. Here we can see the ID canal and then the teeth. So here, the bony defect. Here we can see the mental foramen. Now, there's something called the anterior loop of the mental foramen. So here we need to be away from it with an implant about 5 millimeters. So this wasn't ready for an implant yet because I didn't have enough length to be safe from it. So we wait for the bone to be more, and then we can do an implant easily. So here we can see also the endo treatment. Very good endo, homogeneous, all of those we saw it on the CT scan. Here we can assess caries. As we can see, this one needs root canal, the wisdom needs extraction, and so on. So basically, the CBCT is a very good tool that we can use to plan for implants, to see endo treatments, if they're good or bad, to see treatment outcomes. After a procedure, we did, let's say, remove a tumor, and we want to see if bone formation has happened. We can assess it with the CBCT. So this is basically the lecture. I tried to put it simple and just to help to guide you in which you can see a CBCT and assess it easily without problems. To know what you're looking for, to know how to look for. For example, in this case, we wanted to assess if this wisdom tooth is affecting the 7 roots. Now, it was very close to it, but not causing any resorption, any caries, anything like that. But due to its position, we had to extract the wisdom tooth. And here it helped me it guided me to open a buccal flap and to see the tooth properly. If we have an impacted canine, for example, here, it would help me also to know if it's buccal or palatal. If it's labially, I will open a labial flap. If it's palatally, I will open a palatal flap instead of taking the slope technique. So, all of those are important structures that we can use. It can help us to know how many canals in the roots. So it can help in a lot of things. So always when you're in doubt and the panoramic x-ray cannot show what you're looking for, or you can't see what you're looking for in any of the x-rays, we can go for a CBCT to be sure. And I took some stuff from the white and furrow oral radiology principles and interpretation. So hopefully it was a good lecture. It's very short, but try to make it more clinically oriented and to help guide you through seeing a CBCT scan. The more you see CBCTs, of course, the more you will be able to assess them better. And thank you. If you have any questions, I'm always available.